Hello, my name is Eric Prosher and I represent Jesse Brown VA Medical Center. And you are watching a special edition of Veterans Issues. And over the next 25 minutes, I have two special guests from Jesse Brown VA Medical Center. To my far right, we have Dr. Cal Gowdy, who is our facility VA mission champion, and Mr. Alex Higgs, who is the VA Community Care Mission Champion. And we're going to be talking about the Mission Act and how that improves quality of care for our veterans over the next 25 minutes. And this is all brought to you by CAN TV 21. And so it's a live, interactive show. So call in with your questions about the VA Mission Act. The number is 312-738-1060. All right, thank you for coming on to the show.
My pleasure.
So,
My pleasure.
why don't we just jump right into it and ask, what is the VA Mission Act?
The VA Mission Act is actually an acronym. It actually stands for Maintaining Internal Systems and Strengthening Integrated Outside Networks. So it's actually a twofold process, one of which is maintaining the infrastructure of the VA itself. The second component of it is ensuring that our relationships with the community providers are strong and we have a really, really good business relationship.
Okay. So one of the questions that I sometimes get with the veterans I work with in my clinic is they want to know, is the VA going to be privatized? So is the Mission Act related to privatization? How would you respond to that?
The VA is not being privatized at all at this point.
Yeah, we just want to strengthen and improve the high-quality care system that we have. And if it means involving providers in the community, so be it.
Absolutely.
Yeah. So let's talk a little bit about how the VA Mission Act improves our community care. Why don't we start with that one? Alex?
Sure. Well, there's actually 6 main components that are overarching the Mission Act, one of which is healthcare eligibility. Another one is community care eligibility, which is my department specifically. Then there's urgent and walk-in care, co-payments and insurance, access standards and standards for quality, and a complaint and appeal process.
Okay. So this act has a lot of components and moving parts?
It sure does. Yes, it does.
And how will the VA Mission Act strengthen the VA's infrastructure overall?
As you know, a lot of our VA medical centers are old. They're about 60 years old or so, and we definitely need to strengthen our infrastructure, not only in terms of the buildings, but also in terms of technology. So we want to improve the ability to provide telehealth coverage to our veterans. It may be at the location of their choice. It could be over the phone, it could be over the computer, it could be over tablets, whatever they have at the location they are in. It could be at their home or when they're traveling. We have done that too. We also plan to modernize our computer system. Over the next few years, we'll be switching to a different software which will enable us to obtain data from providers in the community. So these are some of the areas that we are focusing on over the next few years. The Mission Act has a lot of parts to it, and there are some things which we are going to implement within starting the 6th of June 2019. And there are some other areas that we'll be incorporating over the next few years.
Yeah, well, that's what my next question was going to be. I think when have these? Because it sounds, working in the VA, it seems like some of these changes have already started. Can you tell us a little bit more about the implementation process of this Mission Act?
Absolutely. In terms of the healthcare and community care for our veterans, there have been some changes that have been made to the VA Choice program that our veterans currently use in terms of the access standards. moving forward.
So the VA Choice Program, that was a program that allowed for veterans to see civilian providers if the service wasn't available at the VA?
In a timely manner, yes, or if it was not
extended.
available at the VA.
Okay.
Exactly. So
And so it expands the choice program, how?
what it does is we are looking at two standards now, what we call the access standards. These include the drive time and the wait time. The wait time standards that we are going to use is if you're not able to see your primary care provider in 20 days' time, or if you are not able to see your specialist in 28 days, or if the drive time to see your primary care provider is 30 minutes, or to see a specialist is 60 minutes, then you would be eligible for community care.
Wow.
Yes, it is. It definitely improves access to care, and we are also hoping that it improves the veterans' experience as well. Our aim
Now,
is, yes, go
Can the
ahead.
veteran choose to stay with the VA, or is it?
We want the veterans to stay with us, okay, because we believe that we provide quality of care which is better than in the community.
Yes.
We are ready, we treat veterans, community readiness to treat veterans is low. We are training providers in the community as well in terms of the common issues that veterans face. We are an integrated healthcare system, and fragmentation of care, we believe, degrades the quality of care.
Yes.
We are patient-centered care. We offer whole health care. And our decisions, the VA care decisions, are not driven by profit motive or fee for service.
And often our wait times are much better than the civilian.
That is true. Yes, we have studies which indicate that our wait times are better than in the community.
And as a veteran from the U.S. Marine Corps, working for the VA, who actually uses what will be the Mission Act, when I use the Choice Act when it was a Choice Act, I can testify
Yes.
that the services are fluid, they're seamless, and from a user end standpoint, all I really need to do is just let my primary know what I need. The VA Community Care Office calls me to set up the appointment, and they do all the legwork for me. So it's very, very user-friendly for the veteran, and the time and quality of access to community care is outstanding.
Okay. So it sounds like there's some benefit for some services, maybe some specialty areas that the VA might not cover. But how does the VA Mission Act, does it benefit the employees of the VA in any way?
Thanks for asking, Dr. Prosher. One of the things that that the Mission Act also aims to do is not only improving the infrastructure, but also making sure that we are able to recruit and retain high-quality staff. We want to have our veterans the options of seeing excellent physicians. We want to have excellent employees so that we improve the veteran experience. And the Mission Act does provide for flexibility in terms of recruiting and retaining employees. One other thing we also plan to do through the Mission Act is piloting a scholarship program for eligible veterans to receive medical training in return for serving in a VA hospital for 4 years. So I'm very excited with all the options that the Mission Act provides in terms of retaining employees and improving employee satisfaction, which translates to a better experience for our veterans.
Absolutely.
Yes. So for our viewers that may have just joined us, you're watching Veterans Issues with Jesse Brown VA Medical Center, and we have Dr. Cal Gowdy to my far right and Mr. Alex Higgs. And we're talking about the VA Mission Act, which is a new program that strengthens some of the VA's ability to deliver better access, higher quality care to our facilities using technology and our community partners. Is that a good summary of?
Absolutely.
Okay.
Yep.
Yes.
So now, what about caregivers? And I know they have a big role in some of our veterans that that rely on them to get to appointments and to help them with their whole process. Is there anything that impacts how, that expands a caregiver's eligibility?
Absolutely, yes. Right now, we have the Caregivers Act, which helps veterans and their families, or families of veterans who are providing care to veterans who were injured after September 11, 2001. The Mission Act plans to include all veterans. This is going to be done in a phased process. In the second phase, over the next few years, it will include veterans who were injured before May 1975, and subsequently we will include all veterans. So that is what we are looking at.
Excellent,
Yes.
excellent. So over the last couple months, as a provider in the VA, we've had a strong encouragement to use some of the technology like VA Video Connect.
Yes.
Is this a part of the Mission Act, or is this just something that an innovation and technology that's being used in the VA?
This is something we have been using for a few years now. In fact, at Jesse Brown VA, we were just chosen to be the community, the clinical resource hub or the tele hub for our Vision 12 or Integrated Services Network 12. And we are providing services to underserved areas. For example, we are providing primary care to LaSalle Seabog. We are providing care to Toma VA. We are providing care to Rhinelander VA. With our providers based in Chicago, our providers are at Jesse Brown VA and providing care via TV technology. And the feedback that we have got has been excellent. Our patients love it. The providers like the service that they are providing. And we recently also started providing mental health services too. And we plan to expand this as part of a telehub. In addition, we are providing dermatology services, sleep services, pulmonary services to VAs in San Antonio, Las Vegas. So this technology we have been using and expanding on it over the last few years.
Wow, so it really, really increases access.
Absolutely.
I've been
yes.
using it, and I have a veteran that moved from Chicago up to northeastern part of the country and hadn't established contact with the VA there, and so it was vital for that to help that transition. And then she established it, and she goes, "It's not as good as your VA. I want to stay with you." And she
Yeah.
wanted to stay with her psychiatrist and her psychologist. So
Yeah, exactly. Yeah.
So what Dr. Cal Gowdy just covered in a very, very good summary was the first component of the Mission Act, the healthcare eligibility.
Okay.
So mobile health clinics will serve in rural areas that, with the examples that Dr. Cal Gowdy just gave. So when you see those gigantic CT vans that are just parked outside of a hospital or a dialysis unit, a gigantic RV. So those type of services will be available in the more rural areas, particularly areas where there isn't a full service VA medical center to be available.
Right.
As far as telehealth is concerned, it was, once upon a time, you had to have your telehealth services at home. The veteran had to be at the house. Now, because of the new technologies that we have, and there's so many systems in so many different departments,
Yeah.
we're not familiar with them all.
Okay.
But I do know that there are certain systems that they're going to be utilizing
The mobile phones.
through the Mission Act, exactly,
Yes, yeah.
where you can have telehealth on your phone
Yes.
or on a computer, and more importantly, across state lines.
Yes.
So if you need to go visit your daughter in, Michigan or Oklahoma, then I can go visit my relatives and have my telehealth service.
that's right. Previously, I think there was some laws that had boundaries around providing service
State
to the
lines,
state, and that's been
exactly.
changed.
Yes, yeah.
Excellent.
Yeah, it's impressive, yes.
So, are there any if our viewers at home have any further questions about the Mission Act, where would they find that information?
Well, there's a couple of resources. For starters, we have the Mission Act. This is a website, themissionact.va.gov.
Okay.
Okay.
So that's it. So the viewers at home, you see the screen. It's missionact.va.gov. And so if we were to scroll down there, you have some text about how to access care, how to find a VA facility near you, how to learn about your community care eligibility, making appointments.
And how to enroll in the VA if you haven't enrolled in the VA yet.
That's the most important, especially for those veterans that may have just left the service. You got that 5-year window to increase to get enrolled in the VA. All right, and let's see, I'm looking for any phone numbers.
Well, phone number is actually for the Jesse Brown VA Medical Center.
Okay.
Okay.
Yeah. Well,
I have a couple numbers that I can share.
well, we have some phone numbers here. These are for if you want to check us out at Jesse Brown VA Medical Center. We have a Facebook page. If you need appointments, if you're already enrolled, and if you have other questions about the Mission Act, what numbers would they be?
Well, actually, the service number that you have there, that 888-569-5282, that's our call center number. So if a veteran wants to call about any information about the Mission Act, they can call there. But if they're already using the Choice Network, which is now converting into the Mission Act, which is and let me just say this for starters, the Choice Act is ending. That particular program is going to be gone as of June 6th, 2019. That's when the Mission Act kicks in. And the Mission Act is not completely different. It still has a lot of the same benefits that the Choice Act had, but there's more enhancements that are involved into it. So so if there's any questions about the Mission Act now, that 888-569-5282 number can be used for that. But if there's any billing issues that the veterans may have through the Choice Act or what will now be the Mission Act, there is a 1-312-569-6170. That is the number for community care billing. So if they have any issues with their bills being seen outside in the community, even the authorized care ones, because sometimes from time to time, there's a miscommunication between business offices. The veteran will get billed even though they were authorized for care at that facility. So the number to call for any billing issues, whether it's the Mission Act authorized care or it's sidebar programs, the unauthorized care program or the meal bill program, the number, the 1-312-569-6170 is the exclusive number for billing.
Okay.
Dr. Prosher, if I may add,
Sure.
one of the benefits of the Mission Act is that the veterans would be eligible for urgent care in the community. This is something, they don't need the authorization from the VA for urgent care. There are certain criteria that they need to meet. They need to have received VA care within the last 24 months. And after that, if there are any urgent care issues, for example, strep throat or flu or something.
shot,
Yeah,
or-
exactly. So they can see urgent care providers in the community.
Is that any community, or are there preferred people in?
Actually,
in the
those
network?
urgent care facilities or the walk-in, what are they called? The walk-in retail health clinics.
Like
right?
Walgreens has come get your flu shot. and,
Exactly.
No, the
nurse
thing
practitioner.
is, we need to make sure that the urgent care providers are contracted by the VA.
Exactly.
They are
They have to be in our
within
network.
the VA network.
Right. Okay.
They have to be within that. So now you're going to ask me, where can I find information about where can I find information about our urgent care providers?
How about this?
You can go to the www.va.gov and that will give you information about exactly. There you go.
So,
Yes.
for the viewers at home, if you that website that we were just at with va.gov /find locations, let's just try it out. We can you put in your zip code, state, city, state. Let's see. Let's go back. Or postal code. Well, let's do it just to postal code.
60612. Yeah.
And
Click search.
all facilities. Let's see what kind of community care. Nah.
There you go.
Boom.
Yeah.
And we search. And let's see what happens. Hopefully it's up and running.
If it doesn't spool fast enough, you probably have to put a category of care in that
Yeah.
far right field.
Oops.
I know our community care officers are still in the process of developing contracts. And by the 6th of June,
By the 6th of June.
yes, sir, 2019, this will be available.
Excellent. So there we go. So we have already 18 results of community care in this zip code. And they'll shoot out a list with
The only word of caution I
services.
would give is please wait for the 6th of June because that is when it will be fully functional
Yes. And with a robust list of providers as
of
well.
providers, yes. And for if you do not have access to a computer at the time you want to get data, please call the numbers. You can call Jesse Brown VA at 312-569-8387 or the call will be directed to our call center, and our call center employees can find a lot of information for you. They can find out, they can make sure you're eligible to receive urgent care. They can point out to the closest urgent care facility based on where you are at that time, and they can help you out with a lot of information. So please call us if you do not have access to a computer.
Okay, so you viewers at home, we've been talking about the VA Mission Act and how this improves VA care overall. And we got 5 more minutes left, so this is your last chance to call in with questions at 312-738-1060. However, if you're a veteran at home and you're having an emotional crisis and you need to talk with somebody, you can always call the Veteran Crisis Line, which is 1-800-273-8255, and then press 1. And this is 24 hours, 7 days a week. You can talk to a live person, confidential, and they will connect you to the resources to the nearest VA. So don't forget, that's 1-800-273-8255. It's an award-winning program that saves lives. So pass this on. All right, so we have a couple minutes left. Why don't we have 3 minutes left. Why don't we close our round, and I call this segment of the show Rapid Fire.
All right.
And so it's a chance for our viewers at home to get to know you on a more personal level. So I'll just ask you a bunch of questions, and you, just like a free association, you're on my
Sure.
couch, the first thing that comes to your mind. So Dr. Cal Gowdy, what is your guilty food pleasure?
Ice cream.
Ice cream, all right, ice cream, good, good. And if you could, and Mr. Higgs, if you could invite anyone to dinner, who would you invite?
I'll try to associate this. I'm drawing a blank, I can't believe it. Anybody for dinner, who would I like to talk to? Oh, Christopher Walken.
Christopher Walken.
Yeah.
Why is that?
Just his demeanor, though his manner of speech, he just fascinates me.
Okay.
Yeah, absolutely.
Yeah, he's a great actor. Okay, and Dr. Cal Gowdy, what is one unrealized dream you have right now that you would like to accomplish before?
Climbing Mount Everest.
Climbing
Well,
Mount
I don't
Everest?
think I can do it. I don't know.
Haven't you
I've
seen
just
the-
been thinking about
Yeah,
it.
because it's been in the news. You see
It
the
has
lines,
been in the news,
lines,
yeah,
they're waiting
yeah.
to get up there.
At least seeing it, or maybe even flying over it. Maybe.
Flying
I
over
don't
it?
know.
Yeah, okay, well
Yeah.
that is quite
Let
the
me
challenge.
modify it. Maybe seeing Mount Everest.
Seeing
Yeah, there
Mount
you
Everest.
go.
No, don't lower your standards. You gotta climb it now. You put it out there.
I know.
Hopefully
I know.
the price will go down in a couple of years
Yeah.
because it's quite an expensive
Yeah.
enterprise.
Yeah.
Okay, and Mr. Higgs, what is your favorite healthy food?
Favorite healthy food?
Yes,
Grapes.
grapes.
Yeah.
Yeah. How long have you liked grapes?
All my life as a
Oh, you
kid,
like-
yeah, my favorite fruit. Yeah, they're always sweet. They're ready to go. You know,
The green grapes or the purple?
purple.
You like the purple ones?
Yeah, purple
Okay.
ones, definitely.
Okay, cool. And Mr. Cal Gowdy, Dr. Cal Gowdy, next question. If you could invite anyone to dinner, who would you invite?
This is we're talking of not family or friends. Is it
Alive or dead, famous person?
Oh, my grandmother. She is no more, but she is the one I would want to meet
There you
again.
go.
That's cool.
Cool. All right. Mr. Higgs, what is your favorite band or favorite type of music?
Actually, Christian worship music is.
Christian worship music.
Yeah, that's my top of the line genre. I like a lot of forms of music, but as my
Okay.
top of the line one is Christian music.
Okay.
And Hillside is one of my favorite bands.
Hillside.
Yeah,
Very nice.
or Hillsong rather. I'm sorry.
Hillsong. All right. Well, this rapid fire, you guys both hit the target. We've got to know you a little bit. I really want to thank you for coming on the show and sharing with us your knowledge on the VA Mission Act. And if anyone has any further questions about the VA Mission Act, again, you call 312-569. What was this last for it?
8387.
8387. All right. And again, my name is Eric Prosher. We represent Dr. Cal Gowdy, Mr. Higgs. We represent Jesse Brown VA Medical Center. And we'd like to thank you for watching Ken TV 21. And we'll be back next fourth Thursday of every month at 6:30. So tune in and please stay tuned for the next program that follows.